Are you considering using modafinil for ADHD? Hi guys, I'm Dr. Kid and I've spent thousands of hours working with patients with ADHD, and in this video I'm going to do a concise review about all you need to know before taking modafinil and how it's best used in the management of ADHD. So modafinil, typically sold under the brand name Provigil, is typically used to treat disorders of excessive daytime sleepiness. There are actually 3 specific sleep disorders that it's approved for. These are narcolepsy, obstructive sleep apnea, and shift work sleep disorder. With regards to ADHD, it's considered a non-stimulant medication and has quite a different mechanism of action compared to the typical stimulant medications that are used. Examples of the stimulant medication include Vyvanse, dexamphetamine, Adderall, and Ritalin. And how they work is by promoting 2 chemicals in the brain, dopamine and noradrenaline, in an area of the brain known as the prefrontal cortex, which is an area at the front of the brain, and this is the area of the brain that's responsible for executive functioning. Modafinil, on the other hand, has very weak effects on dopamine and noradrenaline. How modafinil actually promotes wakefulness and also works in ADHD is complex and largely unknown. So when would you use modafinil in the treatment of ADHD? Well, usually the first-line treatment for symptoms of executive dysfunction from a medication point of view are the stimulant medications. However, if a patient cannot tolerate the stimulant medication or has a contraindication to the stimulant medication, then you will consider using non-stimulant medications to treat their ADHD symptoms. Of the non-stimulant medications, if you're treating symptoms of poor attention, focus, organization, and planning, the next line is usually 2 other non-stimulant medications, atomoxetine or bupropion, for these symptoms, because they tend to have a higher dopaminergic effect than modafinil. This is why it's uncommon to see modafinil used in the treatment of ADHD, because it's typically considered a 3rd or 4th line option. However, a situation that may suit the use of modafinil is a patient that has comorbid excessive daytime sleepiness and ADHD. You probably would still use the stimulants as the first line, but you may use modafinil before the use of atomoxetine and bupropion in this specific situation. Just quickly guys, if you're finding this helpful, don't forget to like and subscribe to the channel. It will really help me out a lot. So how do you take modafinil? Well, it's best taken in the morning as a single dose due to its wakefulness properties. Occasionally it is taken in 2 divided doses, but this is usually in morning and the midday because you want to not take it at nighttime as it may impact on your sleep. The dosage of modafinil is typically between 100 and 400 milligrams a day. It is recommended to use the lowest effective dose to minimize any potential side effects. Another reason for using the lowest effective dose is that at the time of recording this video, modafinil is actually off-label use for ADHD. Therefore, for most people going to the very high doses, it can get very expensive. So what are the side effects? Well, modafinil is typically well tolerated, but the most common side effects include headache, nausea, diarrhea, and back pain. Headache was the most common side effect at 3% of patients taking modafinil, followed by nausea, which was at 1%. All other side effects for modafinil were less than 1% of patients taking the medication. One rare but potentially serious side effect that can occur with modafinil is a condition called Stevens-Johnson syndrome. This condition is characterized by a whole body rash that can be life-threatening. It is rare, but suffice to say, if you notice a new rash when you start modafinil, stop the medication straight away and see your doctor immediately. So that's my concise review of modafinil and its role in ADHD. If you're interested in other non-stimulant medication for ADHD, check out this video here on atomoxetine, and I'll see you in the next video.